Hello, my name is Paolo Palmisciano. I am a researcher in neurosurgery and hereby I will present you our project evaluating the attitudes of patients and their relatives toward the use of artificial intelligence in neurosurgery, identified as patients' perspectives by LDL stage 0. In healthcare, AI has the purpose to boost productivity by augmenting decision-making processes, outcomes prediction, and treatment efficiency. However, public knowledge of medical AI is overall inaccurate and may hinder its global implementation in clinical settings. So, understanding patients' perceptions toward AI may provide valuable insights to overcome predetermined barriers for adopting AI in medicine, and more specifically in neurosurgery. In our work, we surveyed two different cohorts of patients and we evaluated their background knowledge and perception on AI, the impact of patients' education in affecting attitudes toward AI, and the perceived rates of appropriateness and acceptability in introducing AI platforms in different steps of the neurosurgical workflows. We conducted a two-stage cross-sectional survey. In the first step, we administered a qualitative survey to 20 former surgical neuro-oncological patients, investigating their background knowledge on AI, their perception on medical AI before and after providing accurate information regarding the current use of AI in medicine, and lastly, their opinion regarding potential application of AI in neurosurgery. Once responses were collected, we identified five major themes in implementing AI in neurosurgery, and we created a 5-scenario-based quantitative survey. The second survey was then administered to 107 brain tumor inpatients admitted at the National Hospital for Neurology and Neurosurgery in London and their relatives. For each scenario, we used 5-point Likert scales to rate participants' perceived appropriateness of presented AI platform and acceptability in case of undergoing AI-supported surgery. Differences in attitudes amongst distinct demographical subgroups were further analyzed using chi-square tests with 2x5 contingency tables. Results from the first qualitative survey showed that only the 50% of patients had accurate background knowledge of AI systems, while in the 20% of cases was inaccurate, with patients likely to associate AI systems with robots replacing human workers in regular jobs. At the same time, we proved that providing information regarding the current use of AI systems in medicine improved patients' willingness in undergoing AI-assisted surgery, going from the 35% to the 50% rates. Finally, we identified 5 major themes envisaged by surveyed patients regarding potential application of AI in neurosurgery, namely radiological imaging interpretation, assisting surgeon in preoperative surgical planning, intraoperative real-time complication alerts, and lastly, AI-assisted robotic systems performing surgery in partial or total autonomy. Results of the second 5-scenario-based quantitative survey showed that participants overall agreed with the presented uses of AI in neurosurgery in the preparative settings and in real-time complication alert, but they disagreed in some parts regarding the implementation of AI-based autonomous surgery. Acceptability rates in undergoing AI-assisted brain surgery showed an average similar pattern. Participants overall accepted to undergo brain surgery assisted by AI platforms supporting healthcare providers like neuroradiologists or neurosurgeons in decision-making processes, but they confessed to feel somewhat or extremely uncomfortable in undergoing surgery performed by autonomous systems, especially if the neurosurgeon was not directly involved in the operation. Our results showed that neurosurgical patients are overall aware of AI, but still lack accurate understanding of medical AI, and that education had a definite impact in improving patients' willingness in undergoing brain surgery supported by AI systems. Surgical neuro-oncological patients and their relatives agreed on accepting AI system as supporting valuable tools in assisting neurosurgeons in brain tumor surgery, but they showed evident resistance in AI systems performing the surgery in total autonomy. Moreover, we found that demographics had no role in influencing perceived appropriateness and acceptability rates. In summary, the introduction of AI-based assistance in surgical neuro-oncological care is encouraged by the greatest part of patients and their relatives. The strong reluctance for fully autonomous systems highlights that patients find human relationship uniquely valuable in their treatment. Insights on patients' perception and concerns regarding the use of AI systems in neurosurgery provide a solid basis for future research in this field, which should focus more on creating AI platforms for decision support rather than autonomous systems. Here you can find references cited in this presentation. I sincerely thank you for your attention, and I share with you my contacts in case of questions or interest in connecting for other research project in neurosurgical AI.